Hello. Today I will discuss how marriage and family therapists play a critical role in crisis prevention for college students. College is often described as one of the most exciting seasons of life, but for many students, it is also one of the most stressful. Rising rates of anxiety, depression and suicidal ideation among college students have been documented by the American College Health Association and the Centers of Disease Control and Prevention in 2023. Understanding crisis in college. A crisis in college may include suicidal ideation, severe anxiety, academic collapse, substance misuse, relationship trauma, or identity related stress. From a systemic perspective, crises rarely occur in isolation. They emerge at the intersection of family expectations, academic pressure, financial strain, peer relationships, and cultural values. Rather than asking only what is wrong with the student, MTFs asks what relational and systemic factors are contributing to this distress. Systemic assessment and early prevention. Marriage and family therapists conduct systemic assessments that evaluate suicide risk, attachment patterns, coping capacity, family dynamics, and cultural stressors. For example, a student withdraws after failing an exam, parents increase pressure to succeed, the student feels ashamed and hides struggles, isolation increases, depression deepens. This illustrates circular causality, a feedback loop rather than a single cause. Strengthening protective factors. Family support is one of the strongest protective factors against suicide. MFTs strengthen protective factors by improving family communication, supporting differentiation of self, enhancing emotional regulation, and promoting healthy peer connection. Crisis prevention is not only about reducing risk, it is about building resilience. Safety planning and evidence based intervention. When suicide risk is present, MFTs implement structured safety planning. The safety planning intervention developed by Stanley and Brown in 2012 is an evidence-based approach that helps students identify warning signs, develop coping strategies, list supportive contacts, and reduce access to lethal means. National crisis care guidelines also emphasize collaborative safety planning as a best practice. Family involvement and differentiation. College is a developmental stage of differentiation. Many students remain emotionally connected to family systems. MFT may involve families through telehealth sessions to reduce enmeshment, address multi generational pressure, and support autonomy while maintaining connection. Sometimes, prevention requires shifting family dynamics from performance based pressure to supportive engagement. Ecological collaboration. Using an ecological lens, MFTs understand students are influenced by multiple systems, peers, professors, financial aid offices, cultural values, and societal expectations. They collaborate with campus counseling centers, academic advisors, psychiatric providers, and crisis response teams to provide coordinated care. Crisis prevention in college students is not just about managing symptoms. It is about strengthening relationships, reducing systemic anxiety, and increasing protective factors across family and campus systems. Marriage and family therapies bring a systemic lens that transforms crisis from an isolated event into an opportunity for long term resilience. Early intervention saves lives. Thank you very much for listening to me. Bye.